Now, many people tell 17 News they are being denied a COVID-19 test despite showing symptoms. 17's Amber Frias spoke to healthcare officials about that issue today and joins us now with that part of our coverage tonight. Amber?
Health officials I spoke to this morning say they are working hard to test high-risk patients, but they do recommend patients experiencing mild symptoms to just stay home and quarantine. Dave Anderson's 18-year-old daughter started feeling sick earlier this week.
On Monday, she came down with a fever. She's had a pretty bad headache, and she was coughing a little bit. It wasn't overwhelming, but she was certainly feeling sick on that day.
Classic COVID-19 symptoms, he thought, so he took her into Kaiser to get tested.
We got to the testing spot. They came out and they said, you know, we don't have enough tests, and so we're holding the tests for medical workers, those that are on the front line.
Anderson and his daughter aren't alone. 17 News has received multiple calls and messages from viewers who say they too have been denied a test.
Sunrise Dr. Hamel.
We spoke to Dr. Hamel Cothery this morning about the issue with the number of tests health officials say they have.
They're sending tests to areas that are hit the hardest first, and the Kern County is still not considered a hotspot yet. So we are getting tests. We're getting them extremely slow.
Cothery recommends that patients who are experiencing mild symptoms just stay home and quarantine.
We have nothing else to offer you at this time. If you don't need to be in the hospital, stay at home.
In fact, Cothery's recommendations fall in line with the California Public Health Department's newly released guidelines.
They've identified 5 groups that should be tested. Those that are hospitalized with symptoms of COVID-19 should be tested. Residents and staff of long-term care facilities with symptoms of COVID-19 should be tested. Those at high risk for severe infection with symptoms of COVID-19 should be tested. Residents and staff of correctional facilities with symptoms of COVID-19 should be tested. And finally, healthcare personnel with symptoms of COVID-19 should be tested.
If you still need help determining if you should get tested, Dr. Cothery suggests you download Dignity Health's app.
If you download that, you can talk to a doctor online in real time and tell them your symptoms. And then if they think you need to be tested, we actually have a clinic right off of Stockdale Highway. It's 9500 Stockdale Highway. It's one of the Dignity clinics. You can go in there, make an appointment, and they will test you.
Apple also developed a screening tool to help you determine if you need to get tested. You can find that on their app store or go to their website, apple.com/COVID-19, to access it. And the California Department of Public Health also did the same. You can find their screening tool up on their website. That's cdph.gov.ca. From Southwest Bakersfield, Amber Frias, 17 News.